Okay.
So, very good morning and welcome to the Rhythm Scenar Level 1 training here in Berlin. My name is Jorg Prinz. I'm from New Zealand, but I've been trained in Germany as a medical doctor, and in New Zealand I'm actually working as a naturopath, working mainly with Scenar since about 6-7 years. And in that time, I actually became a trainer for Scenar and will present you today with the basics of how to use Scenar. We do a lot of online training as well in New Zealand and Australia. However, this video will be broadcasted through the Russian written Scenar website. Scenar is an interesting concept that has been developed over the last 35 years in Russia, and the first devices were sort of produced in Russia in the 1970s and 80s, and after the collapse of the Russian Republic, the Scenar was actually introduced into the Western world, which is about 15-16 years ago. Different devices are around. As you can see, these were the first ones here, and now we are down at devices that look like this. The latest development from Rhythm OKB was the Super Probe. A lot of certifications go with the Scenar to ensure that it is a medical device. Meanwhile, the markets in America have been developed as well, so the FDA recognition was not long ago. And Rhythm Scenar is sold worldwide in all these places here. And down here, this little dot is the interesting one for me because that's where I'm working and I'm not living. So, what is a Scenar? Scenar is an abbreviation. SC stands for self-controlled, and EN stands for neuro, and the AR stands for adaptive regulator. So, it's classified as a TENS machine in worldwide medical places like the FDA and the TGA in Australia. But it is more than just a stimulator. It is a regulator, which is a very important thing. When using the Scenar on the skin of a patient there, you actually get an effect that the body regulates itself, and this is done self-controlled as well, which is a biofeedback. Biofeedback is very important because it ensures that the Scenar signal that is applied onto the skin is changing all the time. So therefore, you cannot get any adaptation as you would receive it with a TENS machine. And of course, it works on the energy of a patient, and it works on the nerves of the patients. The details of that will be made clear during this seminar. You can use Scenar in different ways. So it's not the official nomenclature, allopathic and homeopathic, but I like to use this because you can use the Scenar for acute pain as an allopathic tool, as any doctor would do this, and you would call it perhaps electric aspirin, like a TENS device, but it is working better than that. It can be used for physiotherapy, for massage therapy, as a preparation for exercises and for treatment steps. When I call a homeopathic use of Scenar, then we are getting into the actual part of the Scenar, which is basically a holistic medical approach. In that, we would treat, of course, locally where the pain is, but we also would work on general therapy, which means we get a pain relief plus a healing. It falls under holistic medicine in terms of energy medicine. So energy medicine, I use the definition as Donna Eden does. It's an electric stimulation, it is an electromagnetic stimulation, and it's a stimulation of what we call subtle energies, energies that we know exist or we think they exist, but when we use subtle energies, we see effects, so we are quite sure they do exist and that we can manipulate it. Naturopathy always try to describe health as like cooking a soup. If you have got a big pot and you put all your ingredients in there and you don't supply the energy that you could get through a Scenar device, then you will never get a good soup. If you just apply the energy to a pot of hot water and don't put your ingredients in there, you won't get a good soup either. So it both has to come together in Scenar therapy. Therefore, you can see that Scenar is a holistic, completely holistic approach, and I will try to teach you the details of it over the next 2 days. So, how do we apply Scenar? Well, if you've got a musculoskeletal, that's what the MOS stands for, injury there, then we would call this an acute injury and we'd probably treat it every 2 hours till the pain and the swelling and so on subsides. If it is a chronic injury, then we actually recommend treatment plans that start with every second day treatment, then spread it out to once a week, every fortnight. And we do a session of 10-12 sessions and call this a cycle of treatment there, have a 3-4 week break, and then reassess the patient and start again, if necessary. So, Scenar can be used by anyone. 90% of all patients, they go to their GP because they are in some sort of pain. That could be an old injury, or it could be pain coming through a disease. It could be inflammation, and the lifestyle and the diet, for instance, plays a big part in it. It could be emotional pain. It could be environmental problems like geopathic stress, electromagnetic frequencies, and so on. So the big question always is, how does Scenar work? Well, when a person is healthy, not a body, but if a person is healthy, then the body is in homeostasis. I prefer the word homeokinesis because it is balanced, but it is always a movement there. So if you imagine it like a pendulum, that would sort of vibrate forward and backwards ever so slightly, but the body would be still in homeostasis. However, when a disease happens, then actually the pendulum starts to swing out violently. And when we apply the Scenar, we actually get the body to deal with the issue and come back to homeostasis. So quite an easy concept. Scenar therapy is based on many concepts there, and there are a few important ones. Number one, the biofeedback. The biofeedback ensures that the Scenar signal applied onto the skin is actually altered according to what the device is measuring on the skin, and it does that several times per second, ensuring that the changes that are happening under the Scenar electrode reflects the treatment and adapts to this. It is based on acupuncture. We can work on acupuncture points. We incorporate the meridian theory into Scenar therapy as well. It works physiologically. There are a few things that have been studied in terms of what is the Scenar actually doing when applied to the skin. What is happening inside the body. We use reflexology quite a lot as well, and it can be used in manual therapy. So, as I said before, it's a holistic approach. The whole person is treated. On the other hand, it's an individual approach as well, because each client is treated differently. If you have got two clients with the same symptoms there, you would actually not treat them the same. And it's a reflex biofeedback approach. The practitioner basically communicates with the body through the Scenar device. There is a triangle forming between the patient, the practitioner, and the Scenar device that actually stimulates the patient's body to heal. Indications, different countries have got different indications. This is the Australian, New Zealand one. For pain associated with surgery, trauma, musculoskeletal problems, bursitis, and dental problems. However, 35, 40 years of research in Scenar has actually shown that all these diseases can be influenced positively through Scenar therapy once they are associated with pain and discomfort, and you would treat the pain and the discomfort. The underlying illnesses in these areas actually respond very well to Scenar treatment. There are a few contraindications. Patients with electric pacemakers should not be treated. This is mainly the pacemakers for the heart, but more and more electric pacemakers get put into patients, cerebral pacemakers, for instance, to treat epilepsy and other things. Patients who are prone to seizures are actually should not be treated unless you are able to treat an epileptic fit in case it happens through the Scenar therapy. So if you are not equipped with modern allopathic medical equipment in order to treat a patient with an acute seizure, don't do it. Scenar electrodes should not be placed over malignant skin tumors or any other tumors that might break through the skin. And the abdominal area should be avoided in pregnant women in order to avoid an early delivery or abortion. You can use Scenar even for patients who have got metal plates and screws built in for fractures. That is not a contraindication, and there's no different sensation for the patient when you do this. So, Scenar therapy says it combines conventional and an alternative therapy. Scenar is good as a complementary treatment, and it should be used like this. And it helps actually to reduce allopathic treatments in terms of reduction of medication. And it also, because it's holistic, takes into account that a patient is actually not only his body, but their mind as well. The Scenar mechanisms are based on the pain gate theory and are based on adaptive system theory. And this I will explain a little bit later, because this is a very Russian thing, which is not easy to understand without some more pictures there. It is reflex biofeedback, I said this before. The main thing in terms of physiological effect that you can see with applying Scenar is that endorphins and neuropeptides are released, and you can actually measure them. Bioenergetic medicine is a big part of it. More studies over the last 10, 15 years actually have shown how important electricity is in the human body, what it actually triggers, what it is actually signaling. And the question, of course, is, well, how is electricity inside the body used, and how is it generated, and how is electric energy transported throughout the body if it's not the nervous system? Well, there's a theory that the connective tissue is actually working like liquid crystals. And if you've got liquid crystals, then you've got the base for electric and electronic actually inside the body, which we are using when we're working with Scenar or any other electrical or energetic system. The skin and the nervous system are intricately combined through the germinal layer of the ectoderm. They come from the same germinal layer. So therefore there is a good connection between skin and brain, and that's why we are actually able to get such good results with Scenar therapy by just applying it to the skin and get good effects on the nervous system, which actually is the regulator of the homeostasis inside the body. There's also the idea floating around of a perineural system there, and a body matrix that has been actually developed by James Oshman over the last 10 years. It's an interesting concept that seemed to work quite nicely in its theoretical concepts there, and by using it, well, we can see actually quite good results. And of course, we can work with the Scenar on reflex zones and acupuncture points. Acupuncture is a medical modality that is around since 4,000 years or even longer. It has proven its validity. We're still not 100% sure how it works, but there are more and more studies done in order to find out what are the meridian systems. So what can you achieve with the Scenar? Well, pain killing is the main thing. The pain killing effect is quite obvious, but it also reduces inflammation, allergies, and edemas. By using this regularly on an acute injury every 2 hours, you can see quite dramatic results. There is, for instance, a clinic in Germany who uses the Scenar to treat people with, for instance, fractured ankles. Now, people don't know about this one. It takes quite a while till the swelling goes down and you are able to apply an operation and put screws and pins in. However, usually patients coming in on the weekend when they do their sports, Saturday, Sunday, and usually they get operated on a Thursday or on a Friday. But since this clinic is using a Scenar device, they do the operations on Mondays or Tuesdays because the swelling has gone down so much that they can use it quite earlier. It helps to improve the general state, which means the body is more able to adapt. See, adaptation, or just a few words of it, I get to the point of the adaptive systems theory in a minute, but disease in Scenar medicine or in holistic medicine is actually a reaction of the body who tries to adapt to something that's happening from the outside or from the inside of the body. Outside being chemicals, outside being radiation, being stress, things like that. Inside is our thoughts, our emotions, how we deal with things. By using Scenar, we help a patient actually to improve these functions quite dramatically, so that disturbed functions return back to normal relatively quickly. We can speed up or slow down manifestations of pathological processes, which sometimes is a problem for the patient, because when we treat with Scenar, we sometimes make things worse, or a apparently, aren't we? No, we don't. We're actually pushing the patient through the illness a little bit faster. Instead of having problems with, say, a cold for a fortnight, we are dealing with it, pushing it through within a few days. Vascular and blood functions normalize quite nicely on the Scenar therapy. So we can treat high blood pressure and low blood pressure. We can treat the adhesion of red blood cells if they are trying to clot quite nicely with it. Scenar has an effect on the endocrine and immune response of the organism. It actually helps the immune system to fire up and work better, and it helps thereby the normalization of metabolic processes. So, this is just a small introduction of what Scenar can do. But this course is designed to be practical so that you know what's going on. Therefore, I just want to show you how easy it is actually to work on a patient. The thing is, you turn your machine on with a button on the side, and you get this screen there which indicates that you're in manual mode, that you can use the Scenar. It is automatically set to a frequency of 90 Hertz. All these functions are in basic settings here. And now you can start treating. It's turned on, you put it on the skin, and voila, you start treating. Now, what does that mean? What's happening now? Well, we are putting the device on there. It works with an energy of just 1, but it does something to the skin. It influences the skin underneath the electrode. So if that would be a painful place, I could hold it like this and the pain would disappear. Or I can start moving the device over the skin. But that's the easiest way of doing it. However, we have got some buttons on there where we can regulate the energy. So therefore, you put it on there and you turn it up, and you can hear the tickering from going up till you feel something coming from the electrode, which is a nice tickling sensation. Of course, if you turn it higher, it will get painful, but we want to have it in a comfortable situation. So, have a try on yourself and see how it works for you. Can you feel it? Take it up bit by bit, carefully. If you turn it up too high, you will feel the pain. You don't want that. If you put it on your fingertips now, it will hurt you because this part of the skin is not as sensitive as your fingertips.
No. It's really different.
Yeah. Good. So you get an idea what the feeling is. What I want to show you in this 2 days of training is actually how you can use it effectively. Putting it on the skin just to demonstrate it is not a very effective treatment. It's just to demonstrate what the heck's actually happening when you put the machine on there. But what we want to show is actually there are a few procedures in Scenar therapy, protocols, with which you actually can tackle any problem, be it some localized pain or being a painful condition with an underlying disease. So when you do that, following the protocols that we show you, then you're actually quite effective already as a Scenar therapist, although you're just stuck. So keep that in mind. The other thing you should keep in mind is you cannot do anything wrong with the Scenar. You can put it anywhere on the body where you like it. You might not be very effective. However, you're doing something good for the patient or for yourself if you want to treat yourself. Okay, so Scenar, this is the main screen for the bioscenar. And we are in 90 Hertz, which is the base setting there. The energy is usually on 1, which is not indicated. It just changes when you push the plus and minus buttons there. Then you will see in the top corner what's happening. The next thing you can see is here is your indicator for your batteries. So it's 2/3 down, 1/3 still there. And this little field here is usually gray, but it will change its color at the very moment you are in skin contact. It is the skin contact indicator, and it changes to green. Okay. So, is that all right? Can you see it?
Okay.
So now it's gray, and when I put my finger on there, you will see it's turning green, is it? Don't see it from me.
Okay.
Is it green?
Yes.
Okay, and when I leave the finger off, it's turning gray again. So with that, you know that you're having a good skin contact. This is the screen a little bit bigger. This one here is the timer that runs automatically when you turn it on. Pushing any button briefly, and this timer resets itself to 0 and starts ticking again. Every 30 seconds, you get a beep from the machine. That is, if you have turned the beeps on, you can turn it off as well. But that is helpful for procedures and protocols that I will show you. This one here indicates the mode. You can be in dose 0 mode, you can be in dose 1 mode, you can be in dose 2, 3, depending on what model of Scenar you have. There are different versions there. The AM is short for amplitude modulation. What that means, I will tell you shortly, but when you turn the machine on, it's always an off. FM stands for frequency modulation. What that is, I will tell you a little bit later, it's an off. DMP stands for damping, it's an off. The frequency is on 90 when you turn your machine on. You can change the frequency between 1 Hertz and 350 Hertz. And the intensity is usually on 1. On some devices, you can change the frequency between, the intensity between 1 and 8, on others between 1 and 40. And the gap is on 10, which is the lowest, but it can go up as high as 80. This is the service menu. By pushing 2 buttons at the same time, the plus and the arrow one. Just demonstrate this briefly. Can you see it? You briefly get the service menu. If you don't do anything within 2 seconds, it reverts back to what it was. However, if you want to change some things, then you go along with this button or this button. You can go up. With this one, you can go down, and then change the settings inside something that you want to change. And then once you've done that, you just let go. It reverts back to normal, and your new settings are there. But this is something that you can actually take from the manual that you get with the Scenar device in order to change those settings. This is the screen of the Pro Plus devices that Witten is selling. Slightly different in appearance, but the same functions are there, just in a different order there, side by side rather than underneath each other. Okay, this is the service menu of the Pro Plus. You can do changes there as well. So refer to your manual there. That gives you the idea of what's going on. This is just a slide to show what Scenar devices can do. Every Scenar device, whether you've got a home user device or a professional device, it really doesn't matter, can change the energy between 1 and 250. On the professional devices, you can choose diagnostic modes or dose modes. Diagnostic is the old nomenclature, so forget about this. It's actually the dose modes that you can choose. And they are between 0 and 3, depending on which model you have. In the professionals, you can change amplitude modulations between 1 and 1 and 5 to 1. Some of them have got a B function as well. We get to this later. The frequency modulation can be set between swing 1 and up to 4. There's 4 different settings there. There is an FM, and depending on the model, sometimes you've got a bio-G and a bio-F as well. The dampening can be set on all devices between no damping or SC1 up to 4, and there is a VAR, a variable damping as well. Frequencies, depending on the model, between 15 or 354 or 1 and 350 in the newer ones. The intensity can be chosen between 1 and 8 in the older models, or the Pro and Pro Plus models, and the newer ones like the Super Pro and the Bio go up to an intensity of 40. And the gap is standard between 10 and 80. In order to understand what the Scenar does and what differentiates the Scenar from a TENS machine, you need to look at what the impulses look like. This is an impulse of a Scenar device. And this impulse has got a little bit of a dip here, with a little bit of a direct current part of it, and the main part is an AC current, amplitude. And this, what it looks like when it comes out of the machine when there is no skin contact. But the very moment you put the machine with that setting onto the skin, the biofeed mechanism is actually happening, which means the signal gets changed automatically. You don't have to do anything, you just keep it on the skin, and it changes to something like this and produces a wave like that that actually broadens more and more out. And that actually looks pretty much like an action potential of a nerve. That's why they call the Scenar signal a nerve-like impulse. What the Scenar does with that impulse is, it goes to the skin and it stimulates certain nerve fibers. It stimulates the A fibers, but that's not the important part. It mainly stimulates those fibers, which are called C fibers, which don't have a myelin sheet around them. And you would think if they don't have a sheet around them, it's easier to stimulate them. No, they are harder to stimulate, but the Scenar can do that. It stimulates mainly C fibers and contributes thereby to the release of endorphins and neuropeptides, which mainly comes through stimulation of these fibers. Okay, now let's go to the principles. Where are we? Okay, so let's talk a little bit about the principles of the Scenar therapy. How do we do it? What's the practical approach? You get a patient in there and the patient tells you you've got pain and comes with a diagnosis. Well, I've got such and such diagnosis. Actually, the diagnosis is not the concern of a Scenar therapist. The diagnosis is an allopathic diagnosis. Is made by a registered medical doctor. You might not be a registered medical doctor. You might be a physiotherapist. You might be a naturopath. You might be some sort of healer who uses a Scenar device. So therefore, the diagnosis is not important. And you cannot change a diagnosis. You can say, no, the doctor is wrong. It's more than that. That's not your job. Your job is to be a Scenar practitioner. And the most important part is actually the symptoms that the patient is coming with. That's what we're interested in. And we are interested in the symptoms that the patient has now while he's sitting in front of you and wants to have therapy. The here and now is the main principle of Scenar therapy. That's where you focus on. Some patients might come and say, look, I always got this pain at 3 o'clock at night, but he's sitting there at 10 o'clock in the morning and telling you about this, having no pain. Then we have got a slightly different approach to it. However, most patients come and say, I've got pain here or there, wherever it is. That's where you focus. You want to know how strong the pain is. That's very important. You ask the patient, what is the pain? If you say 0 is no pain, 10 is the worst, for instance, what's your pain right now? What do you need that for? Well, there's 2 reasons for it. Number 1, you want to check after your treatment whether you made a difference. And number 2, you want to make the patient focus on the pain and compare it. For instance, they might have pain in the left hand. I want to compare it to the right one. Oh, if I do this, there's no pain. If I do this, it's a 4 or a 5 or whatever it is. So that's important. Patients, if you treat them and they have got, say, a pain score of, say, 9 out of 10, really bad pain, and you work with a Scenar on them, then you actually can reduce their pain. And they probably end up with a pain just 4 out of 10. Well, for a Scenar practitioner, that's great. You have done a difference. However, the patient still feels pain. Not as bad as before, but they trick themselves. They tell you, no, the pain is still there. Of course it's still there, but before it was a 9 and now it's a 4. So you want to show the patient, heck, your body can make a difference. That's important why you need this. Another important thing is ROM. ROM is short for range of movement. You want to know, for instance, if a joint is affected by pain, how far can they move it? So you test the range. How far can they move the arm up and sideways and backwards and over the head, and things like that, in order to demonstrate a patient afterwards that he can do better or without pain. These are the things that we need. And in order to find out what state a patient is in, how stressed they are, you ask for the 3 Gs. The good sleep, the good mood, and a good appetite. If that's all there, it's pretty likely that the patient is not in stress. But most patients who have got severe or a chronic pain problem there will report that they're either not sleeping very well because they can't turn and toss at night without pain, or that they lost their appetite and that their mood is going down. Every patient who has got chronic pain ends up in some sort of depressive state. I wouldn't call it a depression because that's a diagnosis again, but however, those patients are down and you don't want that. Okay, now, let me tell you a little bit about the pathological system. I said before, disease is actually the attempt of the body to deal with influences from outside or inside the body. The theory is based on a student of Pavlov by the name of Pyotr Anokin. He's a Russian physiologist, and he came up with this theory of the pathological system. Say, if, for instance, you've got pain somewhere on the body, say down here in the kidney area, then this pain, if it happens for the first time, sets a message to the brain. Hey, something is wrong here. The brain sends a message back and says, do this in order to try to fix it. Hold your body differently, do that, drink more, whatever it is that comes up. And while this is happening, actually, certain areas on the skin are changing their physiology slightly. That's what we call an asymmetry. Now, you might not be aware that these things do happen with the skin, but I recall for yourselves, sometimes without anything happening, you feel an itch somewhere, or you feel a pain down there. And before you can actually touch it and think, what the heck is it? It's gone again. Now, these are pains and changes in the skin that do happen with certain emotions, with certain thoughts that we have, with certain things that happen around us. And it is a reaction of the body. It's adapting to your thought, and it's producing this short but intense, sometimes, message on the skin in form of an itch or a discomfort or a pain. What's happening? That's exactly what it is that we are looking for. We're looking for these parts of the body where we actually can find changes on the skin, and of course with the pains or the projection of the pain. This could be a pain from the muscles in the back. It could be coming from deeper lying structures like the kidneys, for instance, or even pancreas, something like that. But we treat the pain area and we treat the asymmetries. Very important. Now, our task is, in Scenar medicine, to treat the pain and treat the asymmetries, because the asymmetries are sometimes more important than the pain area. You can sometimes treat an asymmetry here in order to make that pain disappear. And the whole system, which is called a pathological system, collapse and then heal. So, if this is a pathological system there, once everything is treated and comes back to normal, it's a functional system. And that's the systems theory of Anoki, that it goes through these stages. Now, with a trillion cells in the body, or perhaps more, nobody knows exactly, and roughly about 200,000 chemical reactions per second in each cell. You can imagine there's quite a lot of things are happening within the body. So at the same time, you've got asymmetries and pain here from, say, an injury. You can have another thing happening down there because you might be stressed. So there's another pathological system up there. And this pathological system produces more asymmetries. Of course, if that's sort of a minor thing, and this is the major thing, you would expect that the asymmetries are different in severity. And this is the art of the Scenar therapist, to find out which of the many asymmetries that we have on the body constantly at any given time are the important ones, and which do I have to treat in order to get a resolution of the problem. That's the art of Scenar. By influencing one part of a system, we are influencing the whole system. That's also an idea of Piotr Anoki. And sometimes pain areas cannot be reached by the Scenar impulse directly. See, if this is the kidney, then you actually cannot reach the kidney with the Scenar, because the Scenar impulse only penetrates a few millimeters into the skin. It does not reach the kidney. However, if you treat this area here, which has got spinal connections to the spinal nerves there, then these spinal nerves actually can do changes in the kidney area in order to achieve a healing process. Okay, principles of Scenar therapy, dose 0 and dose 1 settings there. We have got a manual mode, or a dose 0 mode, or a subjective dose mode, SDM. That is when you turn on your machine, you're automatically on dose 0. In this one here, in this mode, you can use a brush along the skin. In digital mode, or also called the objective or individually dosed mode, or IDM, you are actually not moving the skener in a brushing way, but you go position by position in order to get some certain numbers that will help you to identify whether you're close to the problem, whether you find the asymmetry or not. What we want to do with either the brushing or with the numbers, we want to find the asymmetry and the small asymmetry. And I will show you in a minute what an asymmetry looks like or feels like. But in Scenar therapy, the only thing we do, we search, we find, and we treat the asymmetry and the small asymmetry. That's all we do. Sounds very simple, but there are a few tricks in the trade that we try to teach you in these training seminars. So, what is an asymmetry? Any pain, any discomfort that you can sense is an asymmetry. The body tells you something is not quite right here. In manual mode, when you brush along the skin, you will actually notice sometimes a change in sound. It might be louder or it might be softer. And in order to demonstrate that, I'll turn up a little bit of energy on my arm. I don't know whether the microphone might pick this up, but you can hear the sound coming along.
Show, please.
When I put it on my arm, you probably can't hear it now. Go a little bit higher. Then you actually get a sound. And usually the sound would be the same all over the place, unless you hit an asymmetry. Then the sound can be louder. Oops, sorry, wrong button. Or it could be softer. Then you can notice a change of color when you brush along there, and I'll show you a few slides in a minute. It can get redder or it can get paler. That indicates an asymmetry as well. The patient might say, oh yeah, that's quite nice, tingling up here, but when you come to down there, gee, I feel it much more, or oh, I can't feel it anymore. A change in sensation indicates an asymmetry. And most often, you most likely will find that there is a change in the stickiness on the skin. Either it glides easily or it gets stuck. And that's the point where you want to actually do something because it's an asymmetry. In digital mode, you will see changes in the numbers. We come to this late in the afternoon or tomorrow morning when I show you how to work with digital mode. Now, asymmetries. Here's a few pictures of symmetries. So as you can see, there's a little bit of a pink area here, and there's a darker area in here. Now, somebody has been working with a Scenar in this area here, and putting the Scenar on there and brushed along, was holding it, brushing it, holding it, and so on. And it did this a few times. And then you can see that the body reacts to it with a pink discoloration there because there's more blood flow going into that skin area. But here, although it hasn't done more than in the other areas, the point actually went darker. This is an asymmetry. You can call this whole thing an asymmetry, and this is the small asymmetry. That is the point that is different from the rest of the treatment area. Here it's slightly different. Somebody has been treating the whole back here. As you can see, here's some redness there, but there's no redness on this side here. So here's the asymmetry, because everything went red except this part and this part down here. So here you've got a visual asymmetry. And often you can see it like this, but more often you can actually feel it with the stickiness on the patient. So here, once again, either the area gets darker or gets paler or changes color in comparison to the surrounding here. What we want to achieve in Scenar therapy is actually we want to achieve a dynamic, which means a change in the conditions of the patients, a change in the pain of the patient, and a change of the appearance of the asymmetry. We want to treat them back to normal. So ideally, when we treat a patient there, we want to like get down the pain levels there, but sometimes we have to settle for a little bit less. We might only achieve a change in pain character from a sharp pain to a dull ache, or the pain location, and even if it's just a few centimeters to one side or to the other side there, then we have actually achieved a dynamic. We want to change the characteristics of a small asymmetry. So if it was a dark red spot, we want to have it paling up again after the treatment. Or if it was a pale spot, we want to actually get the normal color back to it. We want a change of sensitivity and sound and stickiness. So once we got stuck in a place there, at the beginning of the treatment, after the treatment, it should go much easier. Sometimes we see a change for the worse in the patient, which we would call a healing reaction. But as I said before, we sometimes push the body through the next level in order to resolve the disease. Some patients have more pain after the treatment, or more locations where they feel pain, or the skin characteristics worsen. That is sometimes part and parcel of Scenar therapy. However, once that occurs, we make sure that we let the patient go after a session and make it good, make it right for them so that they feel less. But sometimes patients go home and a few hours later they develop these additional symptoms there. So it's good practice actually to tell the patients, come back if you feel worse, because we can do something about it. So, dose mode, that's what dose mode 0, manual mode, that's what we're actually working with today, mainly. And it is used, as I said before, in a brushing manner, moved over the skin, which is quite different from a TENS device. They usually have got sticky pads and cables and keep it on one place, but we don't. We're treating the pain area, yes, but we're also looking, remember, for the asymmetries. The dose 1 mode or digital mode relies on numbers that the Scenar device is able to give us. It is actually a tool that measures indirectly the skin resistance in certain points. And with these numbers, you will be confronted this afternoon or tomorrow morning when I explain what these are all for. When we treat somebody who's got pain, then we work on the painful area, as I said before, and we can make a difference. Somebody here has got some pain, they want to be treated, and we would work on the area where the pain is. They're all happy people here. But then, in order to get a patient to heal, we would need to treat some extra areas that are common to all people. We call them general zones. Zones is something that you will hear in Scenar therapy quite a lot. Zones are areas where you treat, and there's a local zone where the pain is, where the patient reports the issue is, and there are general zones, and they are mainly on the back, and some of them on the belly, where we can actually influence the nervous system, the endocrine, and the immune system. And this is useful for patients, as I mentioned before, who comes in and says, oh, he's got this pain at 3 o'clock at night, but now at 10 o'clock in the morning, he doesn't have pain. So these would be an ideal patient to start a treatment with in general zones. And the general zones that we actually have and that I will show to you in a minute are called the 3 pathways and 6 points on the face, sometimes abbreviated as 3P, 6P for 6, 3 pathways, 6 points. Sometimes we just call it 3 plus 6. And we've got a collar zone, which is in the neck area and a few other places. A palm zone, which is in the lower abdominal and lower sacral area. And then, of course, an abdominal zone where we treat the belly. All these zones have got an influence on various parts of the nervous system, endocrine system, immune system, and metabolism in general. However, whether this distinction between the different parts is very accurate is not quite clear. However, we see more changes in the central and autonomic nervous system when we work on the back of a patient. So, vectors are another thing in Scenar therapy that you will hear quite a lot. A vector is actually giving you a direction. It could be a direction of treatment. In this case here, when we talk about the general vector, it describes the pattern, how the device is moved over the skin. And this, again, it's important. You move your Scenar device over the skin. You're just not holding it in one place or using sticky pads on a painful place. You move it. The general vector is the first vector used for treating an area of pain. So whenever you see a patient and it says it's got pain here, you start to work from top to bottom and from left to right. And it's always your position, your way of looking at the patient, not the patient's left and right, your left and right. And you move your device from top to bottom across an area. And you do it slowly. Can I demonstrate this on somebody? Would you like to come and so I can show how to do general vector? You get
Need to go.
Okay, let's have a break.
Yes, little break.
Okay, you can turn off the camera for a second.
Okay.
I need my patient.
I illegal.
Okay.
You want to drink?
I've got coffee, thanks.
Okay.
Cold coffee makes it beautiful. So what happened with Miguel? Is he gone to the other clubs?
Miguel, second level. Miguel, думает, что good disinformation not interessant.
Not interested. Okay, wanted to go home. Okay.
It's information very interesting for me.
That's very interesting for you.
Yes.
How come?
coffee have 2 alkaloid.
12 calories.
Alkaloid.
Alkali. Oh, yeah.
Кофеин
Yeah.
и теобрамин.
Yeah.
Opposite function.
Yeah.
First 13 second minute work caffeine. Vesicle, all vesicle spastic.
Yeah.
In kidney